Good morning, everyone. This is Jennifer Clark. We're going to be getting started in just a few moments. Please feel free to take a second to introduce yourself in the chat box, and we'll be getting going shortly.
Jennifer, shall I wait until 11:01?
Yeah, I think we should, just give it one more moment, just to see if a few more folks join us.
Thank you to everyone who is introducing yourself in the chat box. Hey, Wendy. Okay, I see that it's 11:02 and lots of people have joined us, which is what I like to see. We're about half of the folks who registered, Jennifer, so I'll get started if that's okay. And you're recording?
Yes, we are.
Thank you. So good morning, everyone. I'm Lorien Castelle from the New York State Coalition Against Domestic Violence, and I welcome you to the 6th Annual Prevention Summit hosted by Initiative. Obviously, we've gone virtual this year. And as Director of Prevention, this is one of the highlights of my year, as we've been able to bring experts in prevention from all over the country to the New York programs, folks who do prevention education, folks who are the education coordinators for domestic violence and sexual assault programs. We've been able to have folks who have a statewide reach. We've been able to showcase the wonderful, excellent work that many of you are doing in your communities as domestic violence and sexual assault programs. So we're really, really pleased to be able to continue this. I did not contract with a national expert on this particular topic because it turns out I have a little experience with engaging school nurses. And it's something that I've wanted to talk to the programs about actually for many years, to do a little refresher. This is something that we often talk about when we do a Coaching Boys into Men training. We sort of add on a little 20-minute section about how to engage school nurses. And it really warrants its own conversation. So I see many of you who are on here who are introducing yourselves. I'm really appreciative to see there's a lot of you that I've been working with over the years on prevention. I invite you to use the chat liberally and share your resources, any successes that you've had in engaging schools, engaging school nurses in particular, during this time of pandemic, successes, things that you've learned, trials and tribulations, anything like that, and we'll make sure that we incorporate that into the presentation today. So I'd like to introduce Jennifer. She's going to take us through the logistics for participating in the webinar. Thank you.
Thank you, Lorien. And hello, everyone. I'm Jennifer Clark, the Operations Coordinator with the New York State Coalition Against Domestic Violence. And just a few housekeeping items for today. As Lorien said, we are going to be using the chat box to post any questions or comments today. All lines are muted. And we are recording today's session, and a copy of that recording, as well as a copy of the presentation, as well as any resources that come up, whether mentioned in the chat box or throughout the presentation, will be shared in that follow-up email. They'll also be made available at the Prevention Summit website, where you found the registration form for this, as well as recordings for all of the previous sessions that we've had. One other thing today, we are offering closed captioning for today's presentation. There is a link to the transcript within the chat box, or you can post the captioning up on your screen by clicking on that More button on the bottom, and that should bring the captioning up. I will repost that link. And with that, I will kick it back to Lorien.
Thank you, Jennifer, and thank you for all that you do for the Prevention Project, and particularly coordinating the summit. You've just been tremendous around all of that. I really appreciate you. And I also want to just do a little shout out to Captioner Andrew and Captioner Josh. So if you need captioning, these two folks are the ones who are doing that for you. And I just noticed something about the chat. If you are, I see a lot coming just to panelists. If you would like for things to be anonymous, feel free to do that. If you want to ask a question or make a comment that is anonymous, that would be fine. And then, one of us will read that out. If you would like for everybody to see your comments, then you have to just sort of scroll down and hit all panelists and attendees, and then everybody will see it. And as Jennifer said, if you post something anonymously, if you post something to everyone, we will assume that you don't mind it being shared, and we'll read that out for the benefit of the people who have had to call in and may not be in front of a computer, so they might not be able to see the chat. If you post it to one of us as a panelist, please let us know if we have permission to share it. Okay, thank you. So without any further ado, I am going to begin by talking a little bit about history, why school nurses, sort of making the case for engaging school nurses, why we think that's part of the solution. And just a little bit of history about me is that I, at one time, worked for both the New York State Coalition and the Pennsylvania Coalition Against Domestic Violence. And when I was in Pennsylvania, we had a wonderful project. It was a grant that was given by the Federal Office for Women's Health in collaboration with Futures Without Violence. And it was I guess a couple years, 2 or 3 year project. And the grant that we wrote was about engaging schools, and we had 5 schools in 5 districts around Pennsylvania. And the main engagement was with the school-based health setting. And so we did a lot of training with school nurses, and then supported with this grant a team. So the domestic violence program, the rape crisis program, sometimes there were crime victims programs, sometimes there was one program that was all 3. And then a Planned Parenthood or a family planning services or clinic in the community. All of those entities would be a Project Connect team. That was what it was called, Project Connect. And it was really lifting up the notion that school nurses are often the primary healthcare giver for a lot of children. And they are often the ones who are doing the flu shots. You know, in high schools, they might be doing STI testing or pregnancy tests, you know, again, sort of depending on the region and where people are. And we'll get into sort of making the case for engaging school nurses a little bit down the road here in this webinar. But the success of that particular program really, I can't say enough about it. It was just tremendous in terms of the findings and the way that school nurses were able to create and be a catalyst for the changing of an entire school climate. So it was really about lifting up school nurses and engaging them to be champions in the schools that they were working in. So I'll be bringing some lessons learned from that experience into our conversation today. I've been asked to just do a bit of a primary prevention primer before we get started. So just to make sure that everybody's on the same page, I understand we've got some people who are new to prevention on the webinar today. And I think it's just sort of good to get some definitions out of the way and be very clear about what we're talking about. It's also really important if you are engaging school nurses and doing some training of school nurses, whether it's stealth training or whether they actually invite you to come in and train them about primary prevention and dating violence. You know, these slides that I'm going to go through very, very quickly are a kind of a good foundation for school nurses and really for anybody in, you know, in a school climate, for administrators, for the superintendents, for the coaches, for counselors. So when we're talking about primary prevention, we're talking not about intervention, although that's really important. Certainly we want school nurses to be able to identify dating violence when it's right in front of them, you know, identify some indicators of that, but we also want them to be able to send prevention messages from their school-based health setting. And so we're really asking people to think about what would stop the violence before it happens. And this is our mantra in every community we go into. And I liken it to this public health parable, a little story about a river. Those of you I've been working with for decades on prevention are very familiar with this story. And really it just has to do with how are people getting into the river, right? We're standing at a riverbank, maybe we're fishing or we're having a lovely picnic, and somebody comes by, they're clearly in distress, there's a potential of drowning. We jump into the river, we help get them out of the river and pass them on to the EMT or whoever it is, get them to safety. And then we sort of move on with our lives, and we realize more people are coming down the river. So we ask for more help to fish people out of the river, right? More and more people. So the whole village comes, right? In this parable, lots of people helping, but nobody stops and says, how are people getting in the river in the first place? Are they jumping in? Is there a bridge out? Are they getting pushed in? So primary prevention is really about looking at the source and making sure that we move upstream in all of our strategies so that we're not just fishing people out of the river, but we're stopping them from getting into the river in the first place. So the other piece about this, and that is a mantra, it's a parable that lots of public health folks will tell you about. I'm curious if anybody in the chat box, if you've heard that before. And the other piece about it, so we're going to the source. The other way we talk about it in the domestic violence movement is that we're addressing root causes. So everything that the coalition promotes in terms of strategies, we try very hard to make sure that we're addressing, more than just domestic violence, right? So if you look at our online prevention toolkit, which is in a link in a slide later, you will see that there's dismantling oppression, there's engaging men, there's an across the lifespan framework that we use, so that there's multiple strategies that could be used for folks at different ages. And that's really important to us, along with strategies for various settings. So mental health and healthcare, workplace, those kinds of settings. And in all of those, we vet them very carefully. And all of those, we're looking at not just the root causes of domestic violence, but the root causes of all oppression. So we're looking at the intersections between racism and sexism, classism, homophobia, transphobia, this heteronormative culture that we live in. So looking at heterosexism, ableism, ageism, and more. And so this is another, sort of public health premise, and not just a public health premise, but a social justice premise. So those of us who know that we signed on for more than a job, it's a movement, right? And sometimes we say, oh gosh, all I wanted was a job where I could help people, and suddenly you're part of a social justice movement. Those of us who have accepted that fact know that when we're working to promote equity and healthy relationships, that these are all the things that the people that we serve are dealing with in their lives. Particularly right now, we're very focused on structural and institutional racism, right? So, and all of these help to shore up this notion of equality, safety, and respect. So there's the root causes. And when we think about social change, we think about passing laws. We think about sort of top down. We pass laws, we enforce those laws, and then we engage community. We mobilize and organize in community so that we change the conditions in our community, in our neighborhoods, in our culture. We change the conditions that allow domestic violence to thrive. So I'm going to be looking at the chat box, and Jennifer, please, if you could interrupt me if I'm ignoring anything that's in the chat box that I should be paying attention to. And as Audre Lorde said, there's no such thing as a single issue struggle, because we do not live single issue lives. So one of the things that we talk about in our sort of domestic violence 101 conversations is we do talk about racism and classism, and we talk about ableism, and we talk about how the domestic violence that somebody is experiencing at home, when they're not safe with somebody who says that they love them, an intimate partner, that often we miss the fact that there are lots of other issues that they're struggling with besides the domestic violence. And so we have all sorts of things, a range of options, a menu of options and services and legal remedies and supports that we can connect people to, but we often don't put it in the context of their entire lived experience. So they may be worried about food insecurity, housing insecurity, things that are either life-generated or something that the abuser is actually doing, a perpetrator pattern that is affecting a survivor and their family. So not a single issue. This is why we're so careful to make sure that every resource that we promote on our toolkit has this sort of intersectional lens. Also, primary prevention is not risk reduction. So, years ago, we had support groups for young women. We taught them to be assertive. We taught them to recognize red flags. We taught them to recognize an abuser when they saw one, and to try to avoid becoming involved with an abuser. And we know that that's not prevention. You know, we know that that's not something that a person can do because nobody is abusive from the very minute that you get involved with them. You know, it takes time and investment. So this whole notion of risk reduction also might include things like, well, learning karate or self-defense methods or things like that. So we know that that's not the way to go. And we've done a lot of work over the years to make sure that we're creating primary prevention strategies that actually talk about what does a healthy relationship look like, and not just being able to recognize those red flags, because those red flags don't always appear in time. And then also, after, one of the things about prevention is if somebody has gone through that kind of training and they do end up with somebody who is abusing them, it's a slippery slope towards victim blaming. Well, you knew all the warning signs. How did you end up here, right? So, you know, we're very good at victim blaming in this culture. Very briefly, I'm just going to go through some of the next slides. Safety tips, you know, the way that we train people to use the buddy system when they go out, to cover their drinks. I've already talked about self-defense. Those are risk reduction strategies, not prevention strategies. Primary prevention is getting to the root cause. So back to the tree. It's a process of changing attitudes and beliefs. It's a process of altering conditions that support intimate partner and sexual violence. As I've said, we're changing the conditions in our communities. We're changing the conditions that are acceptable, that people find tolerable in the culture. And it's an acknowledgement that we can't just accept the world the way it is and expect that the problems will go away. So often we talk about, you know, how many of us grew up being told not to park near vans, not to pull over. Now it's not to pull over even if there's a siren behind you, to park in a well-lit part of the parking lot, not to go out at night, not to wear certain clothes, all of those things. That's accepting the world the way it is, not addressing the people who are perpetrating the violence and trying to stop it there. Okay, whoops, back. And so it involves changing all of this. It's attitudinal, it's behavioral, it's in our environment, it's in the very air that we breathe, it's how we raise our children, it's in our language, it's certainly economic, and it has everything to do with social and cultural norms. So the way we like to think about it is that prevention is focusing on the conditions and promoting behaviors you want people to adopt. So it's not wagging our fingers and saying, hey, you stop that bad behavior, but it's really focusing, mentoring, and lifting up all the healthy relationship behaviors that we think people should be adopting, that we think people should know about, and putting that in front of them as much as possible. All the while, we still need to be doing intervention because the statistics, the numbers are staggering, how many people are victimized. So, but it is addressing the violence after it's happened. So it's recognized, it's responding, it's referring. We call that assess, respond, and pass it on, right? So we also call it sometimes secondary or tertiary prevention. So primary prevention is stopping it before it starts. Secondary prevention might be considered an arrest. And then tertiary prevention might be considered something that would manage the long-term effects of the violence that has happened. So that might be a support group for somebody who is victimized. And that's how we talk about those terms. So that's when, primary, secondary, or tertiary. And primary prevention also has to do with lots of different strategies. So there's no one strategy. We believe that it's multiple messages from multiple messengers that really work. No one campaign will solve the problem. No one class will solve the problem. So it's really our approach is to get a community together to think about all of the different things that they might do that would send multiple primary prevention messages. So, but all of these fall into that category. It's just never one thing. Even community policing, because responding to domestic violence in a responsible way, when police come to the door and instead of walking the abuser around the block and telling them to cool down, they can be sending messages that, you know, children get exposed to. They can see that somebody will be held accountable for using violence. They can see that the parent who is being victimized is treated with respect by the police who come to the door, not ignored. They don't come 9 times and sort of ignore the situation. If it's an arrestable offense, they make an arrest. So that kind of community policing can also be primary prevention for children who've been exposed to violence before, because they get the message that this is not okay. So mentoring programs, much like Coaching Boys into Men or Men Can Stop Rape, home visiting for new parents, where new parents hear about bonding and attachment and adverse childhood experiences and how to avoid them, you know, thinking about learning about child development. All of that can be primary prevention too. And I don't know about you, but they sent me home from the hospital with no manual. They just let me take those babies home with very little guidance. So we really like those early sort of home visitation, early interventions with new parents, and particularly with dads. There's great stuff going on in the primary prevention world that's engaging new fathers and male caregivers. So secondary prevention is efforts to identify those who are already affected while still at an early age. And then tertiary, as we said, is taking care, addressing the long-term effects, reducing the chances of a reoccurrence. And then that's the sort of when framework. We move from when to who. So we have different ways that we talk about, and school nurses are going to know what all of these terms mean. And if they don't, it's an opportunity to sort of engage them in conversations that are very public health oriented and will resonate for them. So there's universal, selected, and indicated population. So these are the who's. And universal means that it's directed, the intervention or the strategy is directed at everyone equally, regardless of risk. So when we go into schools and we address all students about healthy relationships, we're not singling folks out. You can't tell by looking who might be at risk, but the school might. And so there are many, many school districts who decide to do things like support groups for children that they think are either at risk because they believe there's domestic violence at home, or they're at risk of dating abuse in their relationships. But it's sort of everyone gets the message, regardless of whether or not they're being victimized or they're perpetrating, or where you feel they're at risk of that. A selected population is when you are selecting those folks out. And then an indicated approach is aimed at folks who've already victimized or have perpetrated violence. You can still try to prevent violence from reoccurring, but it's not primary prevention. Primary prevention absolutely means before. And then we want to talk about risk factors. So this is all, I'm sort of sharing all of this with you by way of a strategy for engaging nurses to sort of understand what we're asking them to do. School nurses, counselors, whoever you're approaching. And much of this is also transferable to healthcare settings that aren't school-based. So just talking about risk factors, a risk factor, a behavior or condition, it is based on evidence that we believe that we have a theory that it increases vulnerability to, in this case, being victimized, or it increases the chance that somebody might perpetrate. So we talk about those risk factors, and we talk about protective factors. So with the school nurses, what we really want to do is build up their ability and their unique position to be really addressing protective factors. So it's behavioral, social influence, it's policies, again, on the basis of either theory or science that will reduce vulnerability. So that's just, very definitional. And then what are we aiming to change? So we're aiming to change knowledge, attitudes, beliefs, and behaviors. Knowledge is very easily changed, and we can measure an increase in knowledge even after one session with a group of people, that they've increased their knowledge. We have no way of knowing after one session that we're imparting information that it's going to change their attitudes or their behaviors. And so another mantra is that awareness plus action equals change. So we want to get deeper into beliefs and behavior and attitudes to really create this kind of change that we're looking for, making sure that people have the skills that they need in order to live violence-free lives. And we can do this. We have strategies from very, very small children, all the way through to adults that get at this part. One of the reasons that we're focusing on children so much is because if we want to stop violence before it happens, and we want to teach healthy relationships, we know that by the time, their youth are in high school, that a lot of their dating norms, those social norms around their relationships are kind of fixed. So we really want to get at them at a very young age, long before they're dating, talking about healthy friendships, how to be a good friend, how to be a good listener, hands are not for hitting, how to share, those kinds of things. So lots of strategies around that. And this, of course, so no prevention conversation is complete without talking about the social ecological model. And this is another thing that to have in your sort of toolbox for engaging schools. It's really important to make sure that folks know that the most effective prevention strategies are when it's not just directed at the students, but it's directed at their mentors, their teachers, their counselors, their coaches, their teams. And that's what effectively changes the community of a school, the school climate. At a community level, strategies would look like policies, making sure that there's a policy for what happens when dating violence comes to our attention. What happens when sexual harassment in a school comes to our attention? Is there a policy to respond to that? Is it an informed policy that takes into account laws and mandates and all of that, and is victim-centered, so that the student who is being hurt, harassed, abused is really the protected party? So that is just a really important concept. We believe that a school nurse or a coach can be a foot in the door, but we highly recommend as a best practice that teachers are given an opportunity to also be trained, and that parents also get engaged, because that's the piece, that's relationship and community level strategies. The messages that the individual students get will be reinforced by the adults who have influence over them in their lives. So here is another, let me see if I can do this. Another way to look at the social ecological model, the social ecology, whoops. So here we have it again. We've got the individual, we've got their peers and their family, we have neighborhoods. All of these things are providing messaging to the children in our lives about how to behave. We have, places of worship and faith-based institutions, the workplace, schools, healthcare, and then we have government and policy on the outer level. Another way to look at that. So I always joke in domestic violence, we sure do love our wheels. And this is the culture wheel. I like to show this because the power and control wheel is in the center. And for me, it really illustrates how, power and control, whether it's physical, whether there's physical violence or not, is often maintained. Power and control is often maintained because of the threats of physical or sexual violence. And what holds that in place are all these beliefs, all of the behaviors that the culture reinforces. Institutions enforce it and reinforce, but our culture and our values, our rituals, our kinship rituals, all of that kind of reinforces that and holds that in place. So yes, we will be sending a copy of the slides. Thank you. I'm going to keep going, and we're going to get to the school nurse bit in just a moment. The other piece about it is, responsible bystander intervention. It's a term of art. We've been using that for a very, very long time. It's still something that I think is extremely valuable. But bystander sort of connotes standing by, and we want to talk about the difference between standing up and standing by. And so I've come to use the term, I thought it would be sweeping the nation. It's been 10 years and I don't think it is, but how to be an upstander. And so quite often when we're doing training for really for anybody in the community, whether it's young people or adults, we talk about what it means to be an upstander. And we talk to teachers and other school personnel about that. It's part of the parent engagement strategy to talk about being an upstander. And now we're also talking about being an ally. So being an ally is language that's all over in our communities right now. As white folks, we want to be aspiring white allies. And we want to be in alliance as social justice warriors to other forms of oppression, and not always just allies, but as some of us have been talking about, using the term accomplice. We want to be accomplices. So being an upstander, being an ally, being in alliance, stepping up when we see that something is wrong is really what we're training folks to do. And so here's the mantra that I was mentioning: awareness plus action equals change. So we've done awareness raising and education for the past 40 years in domestic violence. It's illegal, right? Domestic violence is not something that we just ignore and shut the doors and say, well, that's their private issue. We don't do that anymore. If awareness and education was going to end it, it'd be over. So there's also this whole notion that we need to teach people to take action. And that's where becoming an upstander comes from. What is the one thing that you can do that's going to be an active way to address this issue? Often when we're engaging men and boys, we're asking them to say, oh, that joke's not funny, to stand up against misogyny and sexism. It might be somebody who is not Jewish, standing up when they hear something that is anti-Semitic and saying, that's not okay, we don't do that anymore. So awareness plus action. So what skills do we want to teach folks? I'm going to stop here for a minute and just see, are there any questions about the definitions that I've shared with you before I get into, I'm just going to share a few statistics about dating violence, and then we'll get to the school nurse piece. Jennifer, is there anything in the chat that I'm missing?
There are no questions in the chat box right now. The only comment that I saw was Andra shared it was hoping to be out of the job in 20 years because DV will no longer exist, which seems like a resonation with everybody in the field.
Yes, I was very lucky 25 years ago to be trained up by a shelter manager, my first job in domestic violence, who said, we need to be thinking about putting ourselves out of business. And I've never forgotten that. So primary prevention is absolutely the way to do that. So thank you, Andra, for sharing. Really good sentiment. Okay, so just a couple more definitions. So you'll find as you look at research, and we will have some to share with you, that the language is really all over the place. We define dating violence at the same way we define adult um, domestic violence, intimate partner violence. It's physical, emotional, or verbal. And if there, obviously there's that sort of a dating relationship. Those of you who are in schools, and I know a lot of you work with young people, you know that the term dating is not resonating for young people anymore. I have 2 teenagers, so I think I can speak from experience. There's all sorts of other terminology that they use. In the research, you might see relationship violence, dating abuse. All of these terms are pretty much used interchangeably. Quite often you'll see adolescent relationship abuse, or ARA, is what shows up in the research. And I'm going to sing the praises of the Futures Without Violence website. They have so much wonderful stuff, not just about dating violence in teenagers, adolescents, but also around healthcare. So I reference a lot of that material. I've been trained up by them, quite a bit on these topics. It's a very, very excellent material, and much of it, their curricula is downloadable and free, particularly around healthcare. So I can help you navigate that website and figure out which curricula to use if that's something that you'd like to do. But what this is not is interpersonal violence. So there's violence in schools. There's girls being violent with other girls. There's boys being violent with other boys, although that's less noticeable. I think when girls fight, it's much more visible because they're kind of stepping out of role. And then there's the dating partner stuff. So our analysis is really about, in order for it to be dating violence, it's a pattern of abusive behaviors. It's a pattern of coercive or controlling behaviors. If that pattern is not there and somebody gets pushed once or hit once, chances are it's not dating violence, although it is cause to be concerned. It's the pattern of really wanting to have somebody under your thumb that makes it dating violence. And so this is very much how we want to be training school nurses, to be sort of recognizing, is it a one-time event or is it a pattern? And then of course, there's, teen victims of dating violence are at risk for a lot of other things. We talk about engaging in risky sexual behaviors. We talk about smoking, drugging, drinking, considering or attempting suicide. I'll get to that in a minute as well. Unhealthy diet behaviors, so sometimes disordered eating, and doing poorly in school. So these impacts are a wonderful way to make the case for school nurse engagement. It's also a wonderful way to make the case that you prevention educators who are on this call are needed by the schools. So, and I know many of you have great relationships with schools, but if you still need that sort of foot in the door. One of the things that I want to talk about this is we really need to be cautious about how we talk about risk factors and risky behaviors, because quite often all of these things on this list, on this slide, are things that are related to the abuse. So someone might not be able to negotiate using birth control in an abusive situation, in an abusive relationship. They might not be able to negotiate when and where they have sex. So those of you who are seasoned know this. So to call it that they're engaging in risky sexual behaviors is not language that I like, but this is lifted right out of the research. Using drugs and drinking, they may not have a choice. They may not be able to negotiate that. We know that the statistics of people who've been victimized, and I'm going to say specifically women, adult women who've been victimized, there's a high correlation of using drugs and drinking. And almost when you do surveys for chemical dependency, substance use disorder clinics, it's 95% of the people who have addictions that they're working on have been abused at some point in their lifetime. And then, of course, getting sober and getting straight is also often undermined by the abuser. And the disordered eating as well. So we love to make the case that when you are preventing dating violence in your school, when you're pulling out all the stops and doing everything you can, that it actually increases academic performance. These are the kinds of things, it's a win for the schools when we can make that case, right? And if there's any school personnel on this webinar, I'd love for you to weigh in about that. What is the thing that would be compelling? So 1 in 3 teens report knowing a friend or peer who's been physically hurt by a partner, but many of them don't know what to do. So this is another compelling argument that 1 in 3 teens believe that their friends need help and they're not sure how to help them. That's quite a large number. So again, a compelling argument. Nearly 1 in 5 women report being raped in their lifetime, and almost half before the age of 18. This is also an argument for primary prevention, if I've ever heard one, right? 1 in 5 women report being raped in their lifetime, almost half before the age of 18. That means that when we're teaching consent in colleges, we're too late. We're simply too late. So this is another, for me, one of the things that we really need to be training schools about. And just to sort of jump ahead to strategies, an excellent strategy is to write a letter to the superintendent, to school principals. They often have community educator coordinators that you might also CC. You might write to the Board of Ed and just sort of lay out this case of why primary prevention around dating violence is so critical. So here's one: approximately 1 in 3 adolescent girls in the US will experience physical, emotional, or verbal abuse from their dating partner. Again, 1 in 3 is very, very high. I forgot to ask permission from Wellspring to you. Is anybody on the call from Wellspring? I really liked this power and control wheel. Of course, there's hundreds and hundreds of wheels. I particularly like some of this that has been changed up a bit specifically for teens. And you know that there's a teen equality wheel as well that will be in your handouts so that you can have both. I recommend that we hand out the teen power and control wheel on one side, and then the equality wheel on the other side. It's such a great exercise. And so I'll explain why I like this so much. I'm going to move forward. It includes social abuse. And it's something that exists in adult intimate partner violence, but it's very much present in all of the research that's been done around teen dating violence. So spreading rumors about the victim, telling lies, making fun of them, sort of that public humiliation that can be such a big part of intimate partner violence, humiliating the victim usually in front of others, right? So it can be done in isolation, and that's emotionally harming enough. But when it's done in front of others, again, in middle school and high school, when they're dating and they're sort of exploring their very first dating relationships, and it's such a, I mean, how many of us would ever go back to middle school or high school for all the money in the world? I mean, not I. So it's a time when people are really fragile in terms of their social status. Destroying the victim's reputation. So quite often, what you'll find these days is the use of devices, right? And so having the passwords for somebody's phone, passwords to their accounts, posting things as if they were them, responding to friends as if they were their partner, something called leashing, which I didn't know about, but my 16-year-old daughter did, and was actually interviewed here by our local domestic violence program. Leashing is, really using the device to keep tabs on their dating partner. And that can be done in a variety of ways, but, when somebody has no privacy on their phone, that's abusive behavior. My daughter at that time had a girlfriend whose boyfriend was very beloved by the family. And she had to go when she was out to buy clothes. Let's say she was at the mall, she would have to take pictures of any of the outfits that she was thinking about buying, and he would have to approve of them or not. Or he would have to approve of her friends. He actually broke up with all of her friends, pretending to be her. And so this is, really, really common behavior. And again, it exists in intimate partner violence. It's adult intimate partner violence. But the consequences for teenagers, context and consequences really matter. And we're going to get to that. So digital abuse, I just sort of went there a little bit, having the passwords, pressuring for photos, the monitoring, the sort of endless monitoring, surveying the victim's location, which we know abusers have been doing. Tech savvy abusers have been doing that for a long time. It's easier than ever. And of course, this going through the victim's phone without their consent. So I sort of jumped to the next slide. Context and consequences. So I just saw something about gender neutral, and I appreciate that you said that, Judy, and I really do try. I am just going to do a little bit of a blurb here, though, about girls. And I agree, the being gender neutral and positing all of this when we're with young people and when we're in any group, the use of gender is something we just really have to be very, very cautious about. But the most recent research is, has to do with the context and the consequences of girls being victimized. And so, here's sort of this laundry list of things that they're at higher risk of when they are being victimized by an intimate partner. And I wanted to go through one that I think is really important and make sort of this compelling case. The rate of sexual victimization is 4 times as high for girls who are being hurt by their dating partner. So again, these are the things that, folks who are interested in health and wellness and emotional wellness are going to care about. And so these are the stats that we leverage. Now, this does not mean that men and male identified folks are not abused, and of course there's all different ways that this can play out. But we want to make sure that in terms of context and consequences, that we are focusing on some of this research that lets us know that when girls and women are victimized, that the consequences can be dire, and we need to be able to talk about that. So this is still not a gender neutral issue. Gender definitely shows up in this conversation around sexual assault and domestic violence in very real ways that we need to be comfortable with. Okay, I'm going to stop for a second. Jennifer, can you help me with the chat? And Judy, thank you for sending that resource. Anything that I've missed that you would like to read out?
No real questions, but Andra, and please let me know if I'm saying your name wrong, did make some mentions about the societal change need in talking about sexual health and wellness as part of prevention and consent.
Mhm. Wonderful. And we are, and maybe this is something that we can send to you. I'm not sure that it's public. The coalition has been supporting a bill that would require all schools K through 12 throughout the state of New York, all public schools, to have a teen dating violence policy and education attached to that. So, prevention education attached. And we've recommended policies, we've recommended curricula, we've recommended that it not be just one curricula because we're a big, diverse state with a lot of different communities. So, certainly I think a community should decide for themselves which curricula resonates. I know probably 80% of you on the phone right now on the call have your favorite curricula to do. So the teen dating violence bill, for some reason, the New York State Department of Ed is really cautious about mandates and adding anything to what teachers have to do. So currently we're part of a consortium, a coalition of sexual assault folks. Our sibling coalition, the New York State Coalition Against Sexual Assault, is on there. The New York City Alliance is on there. Lots of Planned Parenthood and family planning folks are on there. And right now we're supporting a bill that is really about healthy relationships, and it's really, healthy sexuality education. And, but it has all the components that we've just talked about in our definitions of teen dating violence in there. And so we do support it wholeheartedly. We'll be tracking whether or not that happens. We may ask for some support to get that, to get her done. And it's just time. It's time to do that. Now, when that happens, we're all going to come back together in a forum like this and strategize about how to leverage that. A big thing for the coalition is to make sure that the Department of Ed understands that you are already doing this work in your communities, that you are already successfully engaging schools, engaging young people, that you've had these relationships, some of you for many, many years. You're the folks who do the bullying, the education around anti-bullying. You're the folks who come into the health class and sit there all day long, or the assemblies. Primary prevention means that it can't just be one session, one time a year in order to create real social change. So what we're hoping is that we can get some more robust programming into schools with the passing of that bill. So just a little aside there. Yes, Judy, all of that, right? One of the reasons it's not passed yet in the 15 years that I've been working on something like this is because it does require funding. I actually am not a fan of teachers having to do this. We don't necessarily want teachers or we don't want for people to have to feel like they need to be experts in dating violence in order to do this. So I'm hoping for some nice, strong collaborations with programs. Thank you, Joan. The bill text takes the typical approach of determining funding needs once the bill is approved. It's common for the legislature to approve a bill first, get it signed, and then allocate funding in the New Year's state budget. So thank you so much for that, Joan. It's great I love it when our director of policy is here, so she can help me out with the details. Okay, so Alexa, yes, that's the hope, is that organizations that already teach healthy dating have more ability to get into schools. Absolutely, that is absolutely part of our approach. Okay, so here's another compelling why prevention, why work on the prevention side of things. So approximately half of the young people who have been victimized either by a dating partner, some of the research is a little conflated and it doesn't make a distinction between people who are being abused by a dating partner and people who have been abused as a child. But in all of the research and emerging evidence, about half of these young people attempt suicide. So when we're doing prevention around dating violence and sexual assault and sexual harassment and bullying and all of the other things that we do, we're also doing suicide prevention. So just a little thing about sexual assault. So, and I'll make sure that you get all the citations for this in the slides if the slides are something that you will want to be using, so you have all of the research to back you up. In the sexual abuse cases reported to law enforcement, this is really a daunting statistic. 93% of the juvenile victims knew the perpetrator. And, you know, I think that this is really important. 59, so, you know, over half of them were acquaintances, 34% were family members, and only 7% were strangers to the victim. So this is of juvenile victims, so under their majority, so below 18. This is still true. It's very similar statistics for adults. And I think it's really important that everybody in our communities understand that sexual assault is not the person jumping out of the van or from behind the bushes. You know, that 85% of, according to the most recent research, 85% of sexual assault is committed by somebody that we know. And so we've really been addressing sexual assault prevention, you know, from this sort of, you know, risk reduction approach for far too long. It really is about changing social norms. Look at the people, 59% acquaintances, 34 family members. It's about teaching consent early, teaching consent often. And even babies understand consent, right? Like little tiny children understand good touch, bad touch, and nobody gets to touch my body but my mommy, my doctor. You know, I don't have to kiss Aunt Ruth at Thanksgiving. So, you know, children do understand consent, and so I think that that's the way towards prevention here. And then red flags. So we used to talk about red flags, as I've said, as if there was, you know, a secret decoder ring and you could see an abuser coming a mile away. These are different red flags. So I've marked that to remind myself to say, these are some of the things that teachers and parents and caregivers and friends can be looking for if they're worried that someone that they know is being abused. And these are just a few of them: loses interest in hobbies, seems afraid, easily startled, changes in behavior or appearance, becomes isolated. I don't like that language very much because I think people don't become isolated. I think that's a tried and true abuser tactic, right? If you can isolate somebody from their support network, they're much more easy to control. It's not an original story. The unexplained bruises or injuries, of course, defending the partner when people question what's going on, and apologizing and making excuses for their dating partner. So just those are a couple of red flags. So teach early, teach often. I've just said that. I'll say it again. It is a mantra. And it's true in terms of the teach early, because the violence, according to all of the known research, begins between the ages of 12 and 18. So, you know, I remember as a parent of children sort of approaching the age of 12 thinking, there's no way, you know, they're not dating. They're not even thinking about dating. I don't have to have these conversations yet. But I think we really need to, believe the research. The methodologies are sound. There are really smart people who are doing this, and they're saying we've got to start these conversations, you know, way before college. So we believe we can stop it before it starts. All right, I'm going to open up the chat, and again, just a little bit of, oh good, so there's some conversation about the bills. Oh, thank you, Hillary. Yes, I'm not sure if this was said earlier, teaching children from a young age the actual names of their body parts, a huge part in preventing sexual assault. Absolutely, a huge part in being believed. I don't know about other people on the webinar, but I was definitely that mom that was like, I'm really sorry. Yes, I taught them the names of their body parts. It's probably because of the work that I do, right? We're not going to call it a cutesy name. If ever a report had to happen, and we know that when things happen, that it is usually somebody that is in our circle, that somebody that we know, that somebody is trusted, that they be able to use their, the proper name. So thank you for that. I with that mom also, thank you, Shirley. It's so important for them, exactly. So I remember, this is being recorded, I probably shouldn't say it, but I remember my daughter referring to her private parts at a very, very young age as her private party. And so I stepped it up on the vocabulary at that point. Okay, thank you very much for all of that. I'm going to continue because it's 12:05 already. So how have you, if you could just put this in the chat box, we're going to track this and we'll read it back, and we'll save the chat and make sure that everybody gets any strategies or resources that you've shared. So the question is, how have you successfully engaged schools during the pandemic? We do have some ideas. I've collected some information from prevention educators. Some of you might be on the phone, on the webinar. What has worked and what lessons can you share so far? So while you're doing that, I'm going to proceed. Okay, so we've been able to, years ago, the SAGE publications, which you know are often supported by the Violence Against Women Office, and there's lots of cross-pollination between SAGE and the Violence Against Women series. So the SAGE publication is something that is in your resource list, so you're going to get a link to it. It's several years old by now, but every single article, peer-reviewed journal article, was written by folks who are doctors, who are social workers, who are the heads of clinics, the heads of research departments, and they're all very sophisticated when it comes to understanding intimate partner violence and prevention. And so it's sort of lifestyle medicine is the name of it. And one of the things that they put in the very beginning in the introduction is this blurb, which we have used to make the case for healthcare ever since this came out. We must assess for risks of violence in our patients, much as we look for other risks to health. Exploring these risks during a healthcare encounter aids in ensuring that patients at risk will be identified early, that violence will be recognized by healthcare practitioners and health systems as a preventable health problem, and that appropriate actions are taken to prevent violence from occurring in the first place. So when this first came out, there was a prevention cohort here in New York and really all across the country where people use this to go to pediatricians and family medicine practices, where people might be OBGYNs and pediatricians and taking care, really of the whole family. So what I noticed happening, and so there's some anecdotal evidence, is that those lifestyle questionnaires that they would give everybody would suddenly started to have some questions around safety and wellness at home, including for little kids. Asking questions. So it wasn't just, did you eat your vegetables and how much screen time do you get, but do you feel safe at home? When you have a problem, who do you confide in? Those kinds of questions, and really assessing what the situation was at home. More things that make the case that will also be in your resources in terms of links. There's adolescent health guidelines, which say all of the things that we've just talked about. There's the American College of Gynecologists that came out with, now I know this is dated, but a committee opinion is really credible for folks. And it talks about routinely screening women and adolescent girls for reproductive and sexual coercion. And there's a whole way to train school nurses to sort of understand how reproductive and sexual coercion are part of intimate partner violence. One of the things that in my experience with school nurses that they will confess is that, they are, quite often they're doing pregnancy tests for young women and they're repeated, they're over and over and over, and they're not connecting the dots that somebody is getting them pregnant. So this has really transformed the teen pregnancy conversation, the preventing teen pregnancy conversation, because it helps for folks to not just focus on, well, we've got to make sure that these young women aren't getting pregnant. They need to understand what, birth control and, et cetera, et cetera. There's a whole other party that needs to be engaged there. So this is it's not a long opinion, but it is something you could put in front of folks. Certainly connecting with internal and external resources. So as I said, the Project Connect model is something that if you're interested in, it's pretty innovative. I've not been able to get this launched in New York in the 10 years that I've tried, where a domestic violence program, a sexual assault program, a Planned Parenthood or family planning clinic, and a school-based health setting, we're in partnership together. But that doesn't mean we don't stop trying. So there is a New York State Association of School Nurses. There's also a group of people at the Board of Ed who are also supporting school nurses. And then of course, resources, posters, pamphlets, research, bulletins, whatever you can put in front of the school nurse. Including things like, so I said at Futures Without Violence, they do have curriculum. If you want my opinion on some of the materials, I am happy to give it to you, but I think it's worth going on the site and looking at their resources that are available. Again, much of it downloadable and free, but you could also order hard copies. Again, much of it free, but some of the hard copies, and they are sending them out. They did stop during the early days of the pandemic. They're in San Francisco, but they are starting to ship things out again. So there's hanging out or hooking up. There's a safety card. There's a poster. Hanging these things in the school nurse office can sometimes start the conversation. So hanging out or hooking up was revised in 2017. It was updated. Very gender neutral language, very invitational. And it talks about healthy relationships and the dynamics. And it also invites some reflection about what abuse might look like. So these are, these are available. They'll send you a big box. It also talks about birth control. It talks about consensual versus pressured sex. Really good resource to put in front of school nurses. Also fact sheets, other posters. There's a healthy relationship quiz. Love is Not Abuse has one. So many national organizations that focus on teen dating violence have these quizzes. Teen safety cards, conversation starters and tips for parents. I can connect you with those if those are interesting to you. I know one of the things that people are really trying to strategize around is how to engage parents during COVID. Actually, I just talked to a national group of prevention folks who say there are a few places where it's actually easier to engage parents because we're not asking them to come to the school in person, and everybody's getting used to Zoom. Having model school and district policies, I can connect you to those. They'll be in your resource list. Hopefully, as Joan says, we'll have a bill passed soon. And then there are clinical guidelines for responding to adolescent relationship abuse. Those you can find on the Futures website as well. Now, if people are hesitant to do something like this, and of course, I've described to you really a very innovative approach that not every school, even here in progressive New York, not every school district is going to allow. I mean, parents are still able to opt out of general health class, you know, the health class where they learn about their body parts and they get sent home with the deodorant and I don't know what else they get sent home with these days. But I think it's funny that they send the boys home with deodorant after this health class, but you know, parents still opt out of sending their kids to that. So we're kind of suggesting an approach that is really, it's very evidence-based, but it's really not for every district. So taking the pressure off by calling it an orientation when you offer to do a training, it's an orientation. Because you know, some people don't like to be trained. They don't, it's not that they're not trainable, but they don't think they need the training. Calling it a pilot, inviting them to be the first in the county who is, you know, doing this demonstration project. Sometimes that invitation is something that people find, you know, kind of, you know, interesting and something that they can sell. Once you have something going, convening weekly debriefs or check-ins, maybe not weekly, but, you know, once a month, just calling up and saying, hey, how's it going? What are you doing? Asking the school nurse or whoever is doing health classes to co-facilitate something. So really kind of inviting them in and sort of sharing that space. And then, of course, as I keep saying, it's all about providing resources. So the more that you can provide, and I really recommend all the free stuff, you know, and then they'll do it themselves, you know, oh, I'm running out of it. And you can say, well, you know what, you can just go online and order it yourself. But it's a way to sort of get in the door, and people really appreciate all of that. The curriculum that I keep mentioning is a Train the Trainers curriculum. If you are interested in this particular topic around reproductive and sexual coercion, I can take you through it. There's a 1-day training, a full day training, there's a 4-hour training, and there's a 1-hour training. I've seen them all. I've done them all. And you can do it. This is not just for school nurses, but you can also do it for the student health clinicians at campuses. A lot of them, you know, have student-run health centers, high schools, and even, yes, in middle school settings. Middle school is a hard sell. We have a lot of middle school principals and administrators who believe that their kids are not dating, and so don't come to talk about dating violence in my school. So again, it's about putting research in front of people. And maybe we don't call it we've taken the stance of not calling it dating violence anymore when we're selling a program. It's really healthy relationships. Really, so you're leading with the positive, and actually that works for young people too. Posters. So having posters up. Much of what Futures offers is offered in both English and Spanish, and then there are other languages that you can order. Sometimes it's a custom order, but often they have them there already. I think they had Russian last time. They had several Chinese dialects at one point. So, you know, it's worth it to work with them depending on the demographics of your community. And this is just something that's kind of out. I've recommended that people bring this to their local healthcare practitioners, urgent care, whoever you're training, whoever you're engaging in your coordinated community response. You know, those folks love to have, you know, posters up, with the caveat that they go in certain places, right? So if you're going to leave stuff out in the lobby, also leave stuff in the bathrooms, leave stuff in the examination rooms, so that people don't feel like they've got to take it out of the lobby and be seen taking information. But so these posters are available. We recommend that as a strategy. This is all the resources. So Futures Without Violence has, a health resource center, the big conference every year around healthcare. They've been doing lots and lots of work on the difference between universal screening and universal notification. So many of these resources would have guidance around that. And that basically that's, we're not screening at everybody and saying, are you safe at home? And screening is wonderful, and screening can be, a really good step towards intervention. But the best practice is to say, because intimate partner violence is so common, I'm starting to ask all of my patients, and I'm starting to talk to all of my patients about the fact that if you are being hurt at home, if you don't feel safe, that there are resources in the community to help you. If you know somebody, there are resources that you can pass along, and that lets a person off the hook. They may not disclose the first time, they may not disclose the sixth time, but if it's said every time, it normalizes that a healthcare practitioner is someone that they can talk to. I've talked about the lifestyle surveys and incorporating prevention messaging into office visits. Nobody deserves to be abused. If you're not safe at home, there's help for you. And then adding appropriate questions about healthy relationships for the children's piece of the lifestyle surveys. Is your relationship affecting your health is a general safety card. So I just wanted to switch gears a little bit about healthcare practitioners in general. So this is the store for Futures. That's the link there. You will get that. And these are little, the safety card has 5 panels, and they fold up like an accordion into the size of a business card. So again, very, very kind of discreet. And again, best practice is to have them in examination rooms. I did want to just mention also that there's some really compelling research around LGBTQ folks in K through 12, and how much bullying and harassment, and actually how much dating violence happens. And so I feel like this is really important to also to share and to invite school nurses and school administrators to also be champions for LGBTQ and particularly LGBTQ kids of color. Excuse me. So GLSEN is an amazing, I've spelled it wrong. GLSEN is an amazing organization. The link is there. They've got a very updated research. They have amazing tools. This is also something, a poster or a pamphlet in a school-based health setting, in a counselor's office, can make all the difference to a kid who's looking for some support. So the GLSEN Youth of Color report showed a mistrust of educators by LGBTQ students of color and the school system in general. And so it resulted in them not reporting harassment. So putting, again, those very, very high statistics in front of an administrator or a school nurse may be a way to get a foot in the door and to make sure that it's an inclusive and accessible approach that you're taking. So, oh my goodness, this is my last slide. I did it in 90 minutes. I did it in less time. I'm very proud. It's not easy to do. I'm going to open up the chat, and hopefully we can have, I'm really sorry that we can't unmute you so that you can speak if you'd like. But please feel free to put your comments and resources and ideas in the chat. How many of you were able to say, oh, Kelly, unable to engage schools? I'm so sorry to hear that. Kelly, nice to see you. Regarding policy, how are schools handling a situation when a teen couple now has a protective order and of course they chose all the same classes? Judy, I'm going to answer that, and it's interesting that you asked that question. So I need 1 second. Many, many years ago, a school district that actually was doing everything right, I'd say this has got to be 15 years ago, had a school policy, had everybody trained, was engaging parents, really proactive around dating violence and healthy relationships, was put to the test when an order of protection was issued against a student. And both of them were going to this particular campus, a school, high school. And what they did was they did make the perpetrator change classes. I think they had 2 in common. And they then they assigned escorts, adult escorts, to the victim, the female victim, male perpetrator, female victim. And they really thought that they were doing the right thing. Now, what's the problem with assigning the escort to her, the person who's been victimized? I'm going to give this a moment and see if anybody wants to weigh in. Everybody knows. Yep. Anything else? Yes. The question is, what is the issue with? So I'm leading the witness. What is the issue with assigning an escort to the person who's been victimized? It's a well-intentioned strategy, right? That perpetrator is not going to be allowed to come near her. There's an order of protection and there are adults to enforce it. Criminalizes the victim, makes her feel like she's being punished. It's not her behavior that needs to be watched. This is not based on what she does. Finger pointing, probably bullying, it's victim blaming. Lisa, you all won, but it's victim blaming. So, and we do that a lot, right? We expect for the person who's been victimized to change their behaviors and their actions and to change their lives in order to be safe. I would have loved it if that male perpetrator had been assigned the escort, right? On the football field, on the bus, in the cafeteria. And I say that it's I'm being glib about it, but these are how we need to be sort of watching how things play out. Now, the domestic violence program, who was in that community and working very, very closely with the school, was able to change that approach, but it actually took a couple of weeks before they knew about it. So, there was a robust prevention program in the school, and the person who was facilitating the prevention program, and I think it was every week, once a week after school. And then they were also at the school as a counselor. So for anybody who wanted to come and talk about their relationships, or if something was happening at home, they would go to this DV program counselor. But it still took a long time for the domestic violence program to get wind of this strategy. Okay, are there any other questions? I do want to say that, Joan, you've talked about, Lisa, you've talked about Title IX regulations. A school is legally obligated to make reasonable accommodations that are fair and equitable. covers all educational environments. We also have the Dignity for All Students Act, and our Title IX coordinators in the public schools that are K through 12 are often the ones who have the responsibilities of enforcing the Dignity for All Students Act. And so those are the people. I'm making a big pitch for school nurses today, and giving you a lot of sort of healthcare oriented resources, but your Title IX coordinators, your DASA coordinators, those are really good people to be reaching out to. In terms of the COVID piece, COVID can actually be a really good cover for school nurses to be able to, when children are in school, to be able to call them into the office. Sometimes they see them anyway because they've got to administer medication. So that's sometimes a place to start. Also in most of New York that's doing hybrid, you really only have half the population at a time. I know there's at least one school, and if you're interested, I can connect you to them, where the school nurse had gotten wind that domestic violence was on the rise during COVID, and talked about how they were concerned about children being at home in this situation. Also concerned that there may be dating relationships that were where abuse was happening, and that the family had included the dating partner who was abusive in their pod. So the dating continued. And any of you who have teenagers know that that's happening right now. And so, strategizing with the school nurse about, how to contact students safely when they're not in school, how to protect confidentiality, what the laws are around that. Those are the kinds of conversations that really need to be had. So not only do we need to be experts in the prevention piece, but we do need to know the laws. We need to be able to support school nurses who may not really be aware. They may know the laws and the statutes that govern their behavior, but they may not know about other school personnel. And so, we have to come equipped with those kinds of resources too. So we're at time. I see I got a little cocky thinking, oh, we're ahead of time now. And I just sort of kept going. So if there are things that, once you get the resource list, if there are things that you feel are missing, we can absolutely add them. If there are things, if you explore our online prevention toolkit and you think that there are things that are missing, or you find it hard to navigate, please let us know. I've also included Prevent IPV there as a link. It's a wonderful website. I was actually involved, I was very fortunate to be involved in vetting a lot of the resources. And they also go through settings and populations, and there's a blurb that talks about implementation and also evaluation. So anything that's sort of evidence informed and has an evaluation component would be in there too. Some schools want that. So as you start to explore these resources, this is kind of what we do. Please feel free to reach out, and we'll have a chat. We will have one more learning exchange for prevention educators. We're trying really hard to schedule that before the end of the year, so that all of you can talk to each other about strategies that are working and get some ideas about how to start the school year after the new year, and engage schools again, especially those of you who are not able to. And we're hoping to co-host that with NISCASA. So we're actually talking about that tomorrow. So stay tuned for what we're calling a learning exchange. It's a sort of a peer-to-peer learning exchange where you all get to talk to each other. So thank you so much for joining us, and thank you for sending the link, Jennifer. Thank you all for your good contributions to the chat. And like I said, be in touch, be safe, be healthy, and we'll see you next time. Bye-bye.